Welcome to the Heart Rate Variability Podcast. Each week we talk about heart rate variability and how it can be used to improve your overall health and wellness. Please consider the information in this podcast for your informational use and not medical advice. Please see your medical provider to apply any of the strategies outlined in this episode. Heart Rate Variability Podcast is a production of Optimal LLC and Optimal HRV. Check us out at optimalhrv.com. Please enjoy the show.
Okay.
Welcome, friends, to the Heart Rate Variability Podcast. I am back with a past great guest of mine, Dr. Heidi Hillman. She has just published Effectiveness of HRV Biofeedback in Decreasing Anger Among Adolescents with Autism Spectrum Disorder. And I am so excited to talk to her about her research. Heidi, welcome back. It is so great to have you back on the podcast. Obviously, you've been up to something really cool. So why don't you just, if somebody hadn't heard your previous episode, maybe just a quick introduction before we nerd out about the research you've done.
Okay, so I guess a little bit about me. I'm a dedicated researcher and advocate in the field of autism. So if you read a lot of my stuff, you'll kind of get that flavor. I have published extensively in peer-reviewed journals on topics such as anxiety reducing techniques, biofeedback, collaborative strategies for working with parents of autistic children. My work bridges research and practice, focusing on empowering families, enhancing self-regulation skills, promoting just neurodiversity. And since there are very few researchers in the autism field who are actually autistic, I am an autistic, and so I am committed to supporting the autism community through education and evidence-based practices. So, I've kind of gotten into this area because I feel it lends more credibility when it's a person who knows like their participants a little bit better. So that's just a little bit about me.
Awesome. So I'm curious, there's usually around a good research paper, there's usually at least a story behind it. And obviously sharing that you've got lived experience in this area, which it informs your work. But I'm curious, you're putting HRV biofeedback along with autism, but also specifically around anger as well. And I'm curious, just sort of what got you interested to do this specific study.
Okay, so it basically was a dream that became a reality.
It's awesome.
So this has started ways back. So I worked with a student of mine who said, did you know that there's really not much research in the field of anger and biofeedback? And I was like, really? And he was a very angry person and was trying to try all these different techniques that work. And he was introduced to biofeedback. So he found it like, wow, this was really changing. So we did a literature review on biofeedback and anger, specifically on anger management.
Yeah.
So that stuck with me when in the autism world, I thought, autistic teens often experience more anger due to a combination of neurological, sensory, and social factors. So since their brains process stimuli differently, making them more vulnerable to like sensory overload, such as loud noises, bright lights, chaotic environments. This can trigger this intense stress response, which usually comes out as anger. So then add on to that, where then they have challenges with it's a regulation,
Mhm.
and then it's it's communicating those, hey, I am experiencing this overload. So usually it then comes out as this anger explosion.
Yeah.
So, working with autistic teens in my private clinical psych practice, I was seeing this anger, like, let's work through it through a therapy model. And I had this thought of, like, okay, hold up. What if we actually worked on like this biofeedback? Because
Mhm.
autistics love very concrete things.
Yeah.
And so here you have this concrete thing to help you breathe, to help you focus on, for a better lack of words, your internal functioning.
Yeah.
Just reducing that anxiety. So could we use that with these patients of a mine? And then once we do with that, could we actually add on, a de-escalation technique?
Mhm.
Because just the biofeedback by itself, may be effective, may not be effective. But then what if we also taught them this pre getting mad type of technique? And so it was this marriage between my clinical background and biofeedback. And the results showed that all of the participants experienced a decrease in not only the number of anger episodes, um, but also the severity of the episode. So the intensity. And then when the de-escalation component was added, the number of anger episodes and the intensity of the anger both decreased further. And so, this evidence shows that here we can combine. And then the really cool thing that I'm like, is this is the first article that has tried it. Um, I mean, granted, there's three participants. It's a very small sample,
Mhm.
but wow, I mean, it's the first article that is out there that has studied anger among autistic teens, as well as the first article to combine this psychological therapy with a physiological thing, biofeedback.
I love that too because I mean, just with my experience with autistic youth, like and working on one end of the spectrum where there was violence, the anger was too violent for them to be in a typical public school
Mhm.
setting, so it was not. It was that piece of the population. I know we're talking about a very diverse population on every level. It's like I think we tried, and we're working with occupational therapists, and sometimes just trying to figure out what they were telling us might be a good coping skill for them to kind of keep regulation throughout the school day, whether it was brushing, we had a bouncy chair, some just stimming, we weren't thinking biofeedback 20 years ago with that, but it was more from an occupational therapy side. I just love the de-escalation of you're calming the nervous system down through HRV biofeedback and then getting in front of it, which I don't think we were even we were just trying to like control the moment, control the anger. And I would love to hear like what de-escalation techniques worked for these youth because those results are just so incredibly promising that they could really be go from three people to a much wider population.
Mhm. So it is the de-escalation condition. Um, was I taught the participants what I call a four-step de-escalation strategy.
Hmm.
And so this is what they use when they start to feel those emotions.
Okay.
They start to feel those as symptoms. So instead of you using like the biofeedback as here we're going to work on our breathing, here
Hmm.
is something that is very concrete,
Yeah.
because an autistic is a very rule governed person, where if you give them a rule, then that's what they follow.
Yeah.
So I taught them that when you start feeling these behaviors, and we talked about what anger feels like, or that anxiety, you breathe in slowly for a four,
Hmm.
and then you exhale for a four. Something similar that we use with the biofeedback device.
Right.
Then you're going to say to yourself, like, you can say out loud or just in your head, I am angry.
Hmm.
I am feeling mad. And that is okay.
Yeah.
So instead of trying to shove it down, where most it's treatments focus, it's a focus on don't exhibit it. The second thing is I'm feeling this way, and that's perfectly fine.
Yeah.
And then the third thing is, where is your happy place? So we all talked about, what your happy place is.
Hmm.
And for one was petting their dog. For another one was going skateboarding. For another one was, just painting and just slapping paint, just on a canvas.
Yeah.
So it's the third step is now imagine being at your
Mm.
happy place. So it's if you can't get there, then let's think about that. And now let's remove us from whatever environment you are in right now, and let's go to another place.
Yeah.
Is that going for a walk? Is it going to your room? Is it saying I need a break? But instead of staying in that environment, we're now moving out. And so it's this four-step, very simple strategy that then once they start feeling angry, they start walking through this. And so, but before this, we did the biofeedback. So they got in tune with what it felt like to do those deep breaths in
Yeah.
and deep breaths out, and to feel what it was like. And so here's just like this added, more of a cognitive piece of we're talking to ourselves, and now we're removing us, from the environment. So that was biofeed by its biofeedback was put in first, and we saw a decrease, and then after that, we put into, or I did, the escalation technique, and then we saw a further decrease in
Awesome.
both the anger episodes and the intensity.
So one of the things that is really a hot topic in the HRV biofeedback world right now is interoception of being able to be aware of and be conscious of your internal states. And it's just really powerful that what I think we're seeing is being able to catch it before the dysregulation turns into at least angry behavior. It may be anger already, but angry behavior. I'm curious if you ever thought about if do you think the biofeedback practice allowed them to kind of have that sense of self, that identification of anger. Whereas if you just went to the de-escalation without the biofeedback, it may have been more difficult for them to connect with, it's boiling up right now. Like it's coming, right? Do you think that that's where sort of the biofeedback might have been beneficial to these young folks?
That's a great question. I actually haven't thought of that question, but um, I think so because with the biofeedback, the thing that um, the participants really liked was that you had this light and you had to behave in a certain way to
Yeah.
get the light to a change. And so they had to learn what that behavior was and how to do it. And that's a lot easier than me trying to explain, oh, okay, now try this. And I
Right.
want you to take a deep breath in. And I can't see, how deep that breath is, or. And so the biofeedback, since it has that concrete thing that they move, I firmly believe that helped. And then the de-escalation, what I think really then had the impact is anyone who gets mad, we
Hmm.
all know you have
Yes.
that bad day,
Yeah.
and it's that one thing that just sets the day off, and then everything else after it is just crap,
Yeah.
and it's just this crappy day. And so what happens is when you get mad, your cortisol levels in a, it's an increase, and it takes like 45 minutes for it to decrease
Yeah.
out of your body. Hence, anything after that initial crappy day experience, it just leads to more cortisol and it leads
Hmm.
to more stress. And so, one of my hypotheses is, it blends off that question. The biofeedback helped teach them this breathing behavior. Then the de-escalation, techniques, since we're getting at more of a physiological, the amygdala, the cortisol, and so since cortisol levels peak shortly after that anger, onset or a
Yeah.
behavior, um, it's as participants experienced fewer anger episodes, it could be likely that their cortisol levels were actually lower, reducing their sensitivity to these triggers, which then previously had to cause more intense anger episodes. So as we're seeing both the intensity go down, we are also seeing the number of episodes go down. And the intensity, I hypothesis, well, mine is that it's somewhat caused by this de-escalation that, like you said, we're
Yeah.
catching it in the beginning.
Yeah. Yeah. And I wonder, like, because again, with my experience, sometimes you can change your environment. Sometimes it gets a little harder to, walk out if you're got a job, a
Mm-hmm.
little bit, depending on how cool your boss is. Sometimes, I think our youth needed to get away from the environment, but sometimes they just ran a little too far away to do that. So I would be interested, like, do you think that they maybe could eventually, you know, keep in that environment and manage their stress? I just kind of think about like sometimes that's a possibility. Sometimes and I think we do them disservices sometimes of not letting them go, you know.
Mhm.
But the reality is, in some situations you can't. So I wonder if like you think there's almost a potential another step of maybe excusing for a moment, but then coming
Mhm.
back, you know, using the breath to manage within a situation like that. Because I love changing the situation when it's sort of possible to do so.
Mhm. Mhm. I totally think so. It would, the way that I would run with that is if I want the individual to remain in the environment. So
Hmm.
one thing that I write about is that instead of making the autistic change for their environment, maybe we should change the environment
Yeah.
for the autistic. and
Yes.
and so, like, I wrote an article on modifying the work environment to
Hmm.
fit a more sensory diverse
Right.
population. And so then it actually helps everyone.
Yeah, that's what I was
It
gonna say.
it
It
doesn't just
does.
help
Yes.
this or one. So, but let's say we get to a point where we're teaching job skills,
Yeah.
and we are it's a teaching that sometimes, like, you're in a meeting and you would get pissy and you can't just leave.
Right.
So how are we going to work on that? I would start with actually having them leave,
Yeah.
calm down, and then we practice them staying just a little bit longer in the environment, but doing these cognitive things like going to a my happy place,
Yeah.
realizing that I can leave, but it's going to take, a little bit of time here. Um, but in the beginning, I would actually allow them to leave. And then we slowly work back to,
Right.
then you stay in here for a little bit of a time, since there are, times. Or this normal people do it all of the time. They are in a setting and they can't leave.
Right.
So they put their mind to something else. The phone comes out, a
Yeah.
tablet comes out. They just start twiddling their fingers and staring at their hands. They are basically stimming, you
Yeah.
know?
Yep.
And so then that's what I would also teach them, is to give them some coping mechanism that then helps them remain in the environment. That it's not just you have to stay here,
Yeah.
but also give them some coping things where you don't have to engage. You can
Right.
disengage, but you're still present, if
Yeah.
that makes sense.
Absolutely. And that's like I'm thinking about like how we set up classrooms in the school of having a place to go, you know. And again, some
Mhm.
went too far. You know, you
Mhm.
can't go to the next town or you can't go on the interstate or there's safety things concerned with that, but just trying to find a alternative, while making the environment, like you said, more sensory friendly to the students.
Mhm.
That was, I mean, we have harsh environments
Mhm.
in our society that aren't good for any of us, like you mentioned.
Mhm.
And that's where, like, trying to work with them because our goal is to get them back more into a public school setting
Mhm.
with all that stimulation and
Mhm.
everything going on. I was in a middle school hallway, a few months ago, and I was overstimulated. Like, I couldn't imagine the students we had while walking through that. It's just so much going on,
Oh, yes.
and trying to find those solutions with that. I think it's such a powerful way, and then to work again to get what are those coping skills. And does that breath come, like I said, maybe that eventually becomes it, but looking for a way to, self-stem, for lack of a better
Mhm.
word, or maybe for the right word,
Mhm.
to stay in that environment, maybe even a little longer if it's safe for them to do so.
Mhm. Mhm.
I love
Yeah,
it.
it's like one of my participants, you might find this as a funny story, but it's when I was going through the escalation, and he was one of my older ones. And I said, okay, now the third step is, you would go to your happy place. And he goes, wait, 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 wait. Is that Happy Gilmore? I go, yes, yes,
Can
that's
be.
exactly where I got it from. And I'm laughing, going, yes, because him in golf, he was told, now go to your happy place.
That's
And
hilarious.
I'm like, yes, yes. And so then that really helped
Yes.
him because
Right.
he had just seen this really, really old movie, a
Yeah.
Adam Sandler, Happy Gilmore movie.
Yes.
And he got it then. He's like, oh. And it was like, yeah. And so I'm into that where it's now like if we compare things, like they
Right.
understand, they know. And so where is your happy place? You might not be able to go skateboarding, but what do you feel like when you can? Or just like try to imagine yourself back in that spot, and hopefully we get to kind of reduce the anger,
Yeah.
relax you, um, so that now you're presently in that spot. um, and so, but another one of my participants, when I said, now the fourth step is you want to remove yourself from
Hmm.
the environment. And he is like, well, yeah, that seems like the most logical thing, because the environment's making me mad. And I'm like,
Right.
yeah, yeah, you know. And so it's, you know, this could be, a applied to a schools, but I would caution of not just to make them stay in that
Yeah.
environment, like a middle school, like you mentioned,
Right.
middle school. It would be a slow infusion
Yes.
into this world where they get used to the various stimuli. And when they get overstimulated, that's when we pull them out
Right.
and then say, oh, okay. And so you might have one kiddo that can only handle it for a minute, and we have another one who's good for 4 or 5.
Yeah.
And so then it's really dependent on, yeah. But you would bring up a really great point of, what if you can't leave? Well, then we would just stop at the step 3,
Yeah.
where it's, you are doing this imagination, but you're doing the breathing first. You're, focusing on that. And then you would bring up a great point that since biofeedback came first, we can't tease out what caused, a decrease. We saw that biofeedback did decrease anger. We
Yeah.
saw that the de-escalation decreased it further. We can't separate the two
Right.
out. But I feel that you bring up a great point that then, that biofeedback training, since it's very, objective, they get the feeling for what it feels like when
Yeah.
they breathe in and breathe out, and they are now more regulated. That then that made the de-escalation more potent.
Yeah. I'm also curious too because, and this is where the OTs taught me so much about humanity with their approach. Because, usually, I think about when I get anger, and because I practice a lot of biofeedback, I feel like I'm way better than I used to be on this topic. But I kind of joke that sometimes my toaster oven will get me angry. Like it's usually appliances nowadays that can still like push me a little bit further than I'm proud to have gone. But I think it's interesting for folks that the stimulation might be very different, then why are you angry from an outside perspective? may not make sense to somebody who doesn't have, trouble. I mean, I just think about they put something uncomfortable on.
Hmm.
It could
Hmm.
ruin the entire day, So the stress was actually on their body in some way, sensitivity to cold, to light,
Hmm.
to heat, and there was like interpersonal anger as well. But what we saw, and this was a great insight for us, was the anger was most of the time not about us. The
True.
anger was, I'll never forget this one of my favorite people I've ever met in my life, much less worked with, is like he was so sensitive to sound and he got distracted easily. So we wouldn't have started here, but we basically put him in the back of the room facing the wall with head canceling headphones on, and his behaviors went away.
Uh-huh.
Now I wouldn't necessarily, I mean, it wasn't a punishment by any stretch of the imagination. It was just we, as somebody who acted violently almost daily, all of a sudden the things that caused the anger went
Hmm.
away. And now we had one of our best students. We didn't know what to do with him because he's like, we have no behaviors left. And, tried to kind of turn him around slowly to get more and more used to it. But
Uh-huh.
I think that redefines anger in some way. It may have been striking out at us, but it had very, very little to do with us in some situations. In other situations, there was social stressors for sure. And like
Hmm.
catching that and being aware of it, because sometimes they're not running away, they're not getting away, I should say, not running away. They're
Hmm.
not getting away from people per se, even though there may
Hmm.
be other people in the room, which is just an interesting way to, interact and see somebody's emotional state.
Hmm. Oh, like when I work with the parents, I tell them that let's work on the sensory.
Yes.
Let's work on environmental sensories, and we can reduce approximately 80%
Yes.
of all the challenging
Yep.
behaviors that are seeing. Like one of my most popular stories is working with a family, and their son didn't want to take a shower. Well, it
Mhm.
turned out that the shower head, the water was coming out too hard,
Yeah.
and the family was told just shove him into there, and just make him stay there and hold him there and increase the amount of time. And I'm like, no, 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 this is painful. You
Right.
don't realize what the sensory is like unless you have been there. I
Or
mean,
you
like
go in the
an
shower and turn it
itchy
up all the way and ask me to say, like,
yes,
that would be what it would be doing, or turn it freezing cold. Like
yes,
that's what
yes,
we're
yes.
doing. It's just, yes,
Uh-huh.
so
Yeah.
heartbreaking.
And so I went to Home Depot and I bought like six different shower heads.
Yeah.
And we finally found one. And it's the one that we had to get NA attachment, but it comes straight out of the wall. And it's like it rains straight down
Yep.
on you, this a big square.
Yes.
And it was like this rain. And he stood there. And mom's just like, oh, and I'm like, yeah, oh my gosh, even dad's like, this is the best shower head ever. And it's
Yeah.
like, see,
Yep. Exactly.
y'all are benefiting here, from this great shower head. But the way that I try to explain to those that don't understand meltdowns, or they don't understand its sensory, it's a overload. I say we all know what happens with a can of soda when you shake it.
Yeah.
So imagine you're walking around with a can of soda, and all of these little things is just a little shake.
Yeah.
And you're slowly shaking it, and pretty soon the can's getting really tight.
Love that.
And you kind of want to release some of that because you don't want to have this outburst, and you're taught that an outburst is not the best way to do it. And so you try very slowly to open up soda can, and even no matter how slowly you try and pop that top of the lid off, what happens?
Yeah.
I mean, it is just this explosion. So that's how I try to explain these sensory things, is all of these little sensory things that to you don't notice, but it's the noise, it's the lights, it's the sounds, it's the sensory of touching,
Yes.
it's people in your area. They are all just little shakes to
Yeah.
this can.
Oh,
And
it's,
pretty soon the
yeah.
can gets really, really tight. And the only way that you're going to release this pressure is it has to explode. And
Hmm.
once it's exploded, yes, you've lost half the can of your soda,
Yeah.
which is what happens. An autistic becomes very tired. They have lost a lot of their energy.
Hmm.
For some, it's an embarrassment thing. Getting mad is one of those just sensory releases, and it's the can. It's just been shaken, and it's just has to explode. And then when you end with that, you get a brand new can, that's closed. And so I try and use that to explain, what it's like,
Yeah.
that it's not a fit to get what you want.
Yeah.
It is because there's too
Right.
much stuff coming at you. And so that's what I was trying to do, like with the de-escalation, was try to prevent this can from being shaken,
Yeah.
so that it doesn't explode, or it
Right.
doesn't explode very often.
Right. And that was like the big what I love about the field is like, it was kind of because I this was in the early aughts, so it's like still behavioralism was dominant in there, and it just failed miserably. And we were trying to figure out, like, none of this seemed like logical from a behavioral perspective. It just did not work. And we were trying to figure out, there was a group that was arguing it was more of a Tourette's sort of response. And I thought that was interesting. It got me thinking though of an uncontrollable tic may have not have been the right diagnosis many years later, looking back, for some of the can going up. But it started to get me thinking of, it wasn't a controlled, that there wasn't a whole lot of ability to control the response, because we weren't teaching them necessarily how to do that, like you're doing here. We were just, oh, if you craft the punishments and rewards the correct
Mhm.
way, that worked. That did not work. I mean, there were good rewards. That I remember one person like loved Bruce Springsteen, so behaved all week. We would jam out to Born in the USA for a couple songs, and the behavior went away. Like, so there was some of that, but I'm trying to understand it from an environmental stimulus response perspective, but the stimulus being sensory stimulation just was a game changer
Mhm.
for me. Again, even if Tourette's was maybe not, it never caught on, but
Mhm.
their I think philosophy in general was trying to get at something bigger, which I have total
Mhm.
respect for what they were trying to do with that, for sure.
Mhm. Mhm. Yeah, it is the darker side, because I'm a trained BCBA. And
Hmm.
so the one thing that, as I've worked in the field more and more and more, is this, like you said, the behavior went a away. Well, did it go a
Yeah.
away, or did the person just not exhibit it in the presence of you?
Right.
So it is, I am learning, and it's a term that we use in the community, masking. So
Hmm.
I'm going to mask. I'm not going to show my displeasure. I'm not going to communicate, what I need. I am not going to stim. I am not going to, I'm going to act appropriately
Yeah.
to get this Bruce Springsteen.
Yeah.
Um, but does it mean that we've actually, switched the behavior off?
Right.
Not, not technically. The behaviors, we have just taught them how to shove it down, which is why that de-escalation part on the step 2 is I'm feeling angry and
Yeah.
it is fine,
Yes. Yes.
because I don't want them to put that mask on and then say, "Oh, I'm not mad." No, no,
Yeah.
no. Feel the mad.
Yeah.
But let's try and work with it to, put something else that is a better behavior for both you and people around you.
I love it. I love it. So I love to, get any advice that you might have. The behavioral approach seems fairly straightforward, the de-escalation side of things. So if there's any practitioners out there that would like to work with this community,
Mhm.
maybe schools or just individual. I'm curious if you have, kind of have any suggestions for maybe somebody without as much expertise as you did about how to set up the HRV biofeedback in any way that might be different for folks, with autism. Like, is there any suggestions that you might have for folks interested in working with this population?
That's a good one. I guess my biggest takeaway point, because I have noticed this is with anything.
Yeah.
Um, you read that something works for group A, and then you automatically apply it to group B.
Yeah.
Take anything from weight loss to exercise to stop smoking to whatnot, and you
Yeah.
read this. Oh, it works for them, hence it's going to work for me.
Yeah.
That would be my biggest takeaway. What I did with this and what I recommend, find the function. What
Mm.
is the reason behind for this article, anger?
Anchor. Yeah.
So if it's because I am getting angry because I'm presented with a demand, biofeedback might not help you,
Yeah.
because the function is they have learned that anger gets me out of this
Yes.
request.
Yes.
My participants, they all mentioned, I don't like feeling this way.
Right.
And so the anger was more of a sensory overload. That was the function. The function was there was just too much going on and they just exploded. But they didn't realize it till we actually started working through what the function is. So that would be my biggest first step, is find what the function is,
Yes.
then replace it with a wanted behavior.
I love it.
It's a behavior. So for this, it's biofeedback would work well if it's the environment that is causing this anger or this, dysregulation. Um, then it might very well work. Same with de-escalation. It's that can work with lots of things,
Yeah.
but if, like, let's say the individual has learned that when I get mad, I don't have to do chores at
Mhm.
home,
Yeah.
um, having them do de-escalation isn't really going to help it's the anger much.
Yeah.
But what you can do is they have learned that it gets me out of
I love that.
a chore.
Yeah.
Teach them how to request getting out calmly and appropriately. hey, I am playing my game right now. Can I do it in 10 minutes? So then we might actually do a de-escalation before that. We take a deep breath in. That might be where a biofeedback might work, where we teach them, what does it look like to
Hmm.
calm yourself down? And now we're going to teach you how to request.
Yeah.
So that would be my biggest take away is that just because this is effective with this anger among these participants, it was based on a function. It wasn't just plopped in there because like, let's see if it works,
Right. I
um
love that.
and so that's what I would say to a practitioners, don't just throw it in there and then say, let's see if it works. It's actually find the function and then replace that function with a wanted behavior, and now you're getting the same outcome.
Beautiful. So I'll start to wrap up on a very small question. I know throwing this out there,
Uh-oh.
that might be bigger, but we nerd out in the HRV arena, HRV biofeedback about autonomic health and the front left lobal, the prefrontal cord. We get into the weeds about what are we strengthening, what shows up bigger in a functional MRI, tracking heart rate variability and autonomic health. With the students I worked with, they're it was very they were amazing people that we're not broken. Like I think it's like, oh,
Mhm.
we need to fix this, and I hear this in our country right now, and it just drives me crazy. I'm like, no, these are wonderful human beings who sometimes we just put in environments that set them up to
Mhm.
fail. Like,
Mhm.
so when we think about the neurodiversity, and I know that's a big word that can range, but with autism specifically, you know, strengthening the vagal nerve, building prefrontal cortex ability to downregulate amygdala, all the things we nerd out about. Do you think anything specific there that really helps with the sensory tolerance, if I'm, a word, or, kind of being able to, put the can down and tap a little bit on top in this scenario that might be dysregulating? Is there anything specific that when you think about the autonomic or the nervous system health of the folks you work with that biofeedback might be targeting something specific, or is it just the general benefits that we can all get from a biofeedback practice?
Great question. I think what it's doing is it's calming.
Yeah.
Is it's calming all of those areas. It is, like the way that I explain to a teens who don't get it is I say, imagine your brain is split in half, and the top part is all of your
Yeah.
rationalization, your thinking, your what do I want for a dinner, emotional, where you're aware, you can regulate a bit more. The downstairs is your amygdala, which
Hmm.
is your firefighter that thinks that there's this huge fire and it's
Yeah.
trying to put it out. And
Yeah.
it doesn't care how much of the house you're a body it destroys. It is just trying to get rid of it. So
Beautiful.
most autistics, because they are living in a stressful world, they are doing a lot more living in their amygdala. And because of that, it's a lot more cortisol. It's a lot more reacting. It's not pondering, thinking that upstairs part of the brain, which now they can realize I am mad. Now let's change it. You can't do that because it's what I call a amygdala hijacking.
Yeah.
The amygdala turns off that thought process. So I think that's what the biofeedback does, is it
Mhm.
calms the entire neural system from brain to heart, that when we're slowing things down, the amygdala is like, oh, well, I guess there's no fire. I'm going to go to a bed, you know? And then it disappears, and now we can function a little bit better. We aren't living in this constant amount of stress. But when it comes to an autistic, um, I go very behavioral, because then that helps them when you can see it. That's the reason why, this like a mindfulness things doesn't work really well,
Mhm.
because most of like the tracks like you will listen to, imagine yourself
Yeah.
getting blown
Yes.
away. And then my kids are like, wow, that's a really strong wind. Holy
Yeah.
crap.
Very literal. Yeah.
Yeah. And so those are things don't work,
Yeah.
which I think that's why biofeedback can be very an effective treatment, is because we're teaching them based on this thing that they can see.
Love
And now they're changing something inside of them that they can't see. And then we talk about those feelings. Yeah, but that's a great question. I mean, to long-winded answer.
No, it's
Um,
great.
but it's, yes, I think that it's just calming the entire system down, which then leads us to the ability to now, you
Yeah.
know, rationalize through a life,
I love
instead
it.
of reacting through a
Yes.
life.
Yeah, absolutely. So final question, what's next? You ran it with three people. I mean, we're going to link to the article. So I hope we can get some professionals to your research, because I think it's really showing something that's incredibly promising for a lot of folks. But just kind of, I mean, are you done with this topic? Are you gonna do a little bit more with it? Like, I'm curious where you think your next step is going to be around your research.
So, one thing that makes this study stand out is that it also had a 6 month follow up.
Hmm.
So, once the participants were done with me, I followed them for 6 months. Um, that's something that I would like to do further, where if I replicated this a study to include a longer follow-up, or possibly with these same participants,
Yeah.
see where they are at, like in a year. Another step is generalizability.
Hmm.
Um, Taking this to various different areas, and not just focusing on just the clinic or school,
Yeah.
but can this work in a whole host of areas? Because that's the whole thing about changing behaviors, is doing this and having the behavior go back in 12 months. Well,
Right.
that's, we aren't sus we aren't sustaining this wanted behavior. It's kind of like, well, then we aren't doing anything great then.
Yeah.
um so that is what my next step would probably be, is replicate this, and then uh do a longer follow up. And then also, since anger, you know, it isn't picky about what setting it pops up in,
No.
then also hit that generalizability more.
Awesome. Well, my friend, you are a gift. You've given the world a gift, so I'm excited to share this. with our listeners. So please, when you do get that next step going, I'd love to again have you back on and see what you find out in your next steps because I'm really excited about your research and that HRV biofeedback. You're finding it effective in this, with the folks that you're working with, and building onto that in really innovative ways. So I'm excited, whichever direction you go. I'm excited to keep learning from you and just yeah, love your work. So thank you for everything you're doing.
You're very welcome. And I love your podcast. So I appreciate, coming on. I feel honored, especially since I don't feel like, I feel like I'm still a newbie, in this area. So I appreciate, coming and sharing in your enthusiasm about the topic. So it's yes.
Thank you so much. We'll put a link to the article, some information about Dr. Hillman in the show notes, which you can find at optimalhrv.com. So thank you everybody for joining us. Dr. Hillman, thank you so much for you and your work and sharing it with our audience. And as always, we'll see everybody next week.